All right, so here we have an interesting case. These are anteroposterior and lateral views of the left lower leg of a very young child, possibly under a year old. Now, what's important to notice here is the stage of bone development, which is key when assessing pediatric fractures. We can see that the tibia and fibula appear unremarkable, but take a close look at the distal femur. You'll notice an unusual appearance that is quite suspicious for a fracture. The positioning and alignment of the femur appear slightly off, raising concern for a distal femoral fracture, which is highly unusual in a child of this age. Kids at this stage of development aren't typically walking, so an injury like this raises a significant red flag. One thing we have to consider here is the possibility of a non-accidental injury, and it's crucial to handle this with care. From a management standpoint, I would make sure the child remains under observation in the department and immediately contact the pediatric safeguarding team to discuss the case further. It's absolutely essential to follow local policy in cases like this to ensure the child is protected and appropriate actions are taken. Now, from an FRCR examiner's perspective, they may ask, what additional imaging would you consider in this scenario? A skeletal survey would certainly be indicated here, and it's vital to mention that these cases should be double reported by experts to rule out any potential for missed fractures. The examiner might also want to test your understanding of non-accidental injury features, so be ready to explain things like metaphyseal corner fractures, spiral fractures of the long bones, or any associated signs of head trauma, which are key markers in suspected child abuse cases. Lastly, when thinking about differential diagnoses, conditions such as osteogenesis imperfecta, which is linked to fragile bones, or conditions like scurvy or congenital syphilis could be considered, though they are far less common. All right, that's the breakdown for this case. If you found this helpful, don't forget to subscribe to Radiology Made Easy, leave a comment, and share the video. See you in the next one.